Hello all, old Jack is back after my distal bicep tendon surgery. It is now a little over, it's about 6.5 weeks past surgery. The long awaited day, April 19th, that I was waiting for, had my appointment with the surgeon today. Said everything looks great. My range of motion is full in every respect. I can move any direction I want to, no problems at all, no pain. He finally cleared me to start doing a little bit of exercise. Nothing too crazy, but he said I can start doing push-ups now, and I'm going to start doing those first thing tomorrow. I'm cleared to go swimming, and he wants me to rehab starting this week with a 10-pound dumbbell, high rep, of course the low weight, and he's going to allow me to increase by 5 pounds every week. So that'll be for 6 weeks, and then once I hit that 6 weeks, I can start doing pull-ups, and I can start rebuilding again. So the measurement on this arm, just because I've been moving it around a lot more and able to use it. Before it was right around 14 inches, and now just bent, maybe hard to see, but it's about 14 and a quarter. And so it's already starting to respond to movement. I was supposed to wear the brace up till today. I ditched that sucker about 10 days ago. I was over it. So I wasn't using the brace. He was kind of surprised to see that. But he said, hey, if it's working out, it's working out. So that's perfectly fine. The scar itself, if you could see, it's healing very well. Looks really good. The only issue I did develop was a Raynaud syndrome, which, because he had to clamp off some arteries in there, or a couple of the main ones, in order to do the surgery, it pinched some things off in there, and it's really hard. It's almost impossible to find my pulse now in this hand. And if it's below maybe 60 degrees, 50 degrees even, from the knuckles on down, they just turn white. The circulation is really not that good in there. So he said he expects that to clear up in a few months. Once I start training again and pumping blood into the arms again, that should expand, and he expects that it should resolve itself. So that's about it. Full range of motion, starting rehab now 6 weeks, clear to do whatever I want to do and start rebuilding first week in June, which I'm looking forward to. And that should be the end of that. If there's anything more to tell you at that point, I'll check in then. Other than that, old Jack out.